Can intermittent fasting mitigate opioid addiction and side effects? New research from the University of Arizona suggests that a simple dietary change, intermittent fasting, could fundamentally alter how the body responds to opioid medications. By observing the effects of fasting on animal models, scientists have uncovered evidence that this regimen may enhance pain relief while simultaneously reducing the risk of addiction and common side effects. Breaking the cycle of reward and addiction, the core of opioid addiction lies in the brain's reward circuit. When opioids are consumed, they trigger a surge of euphoria, teaching the brain to crave the substance to achieve that same high. This cycle is what leads to dependency and long-term addiction. In a recent study led by Dr. John Stryker, researchers tested this mechanism using mice. The study compared two groups, a control group with unrestricted access to food and a group following a 6-hour daily eating window. Both groups were administered opioid treatments. The results were striking. The control group showed the expected reward response, demonstrating the typical euphoric association with the drug. The IF group showed no evidence of reward. These mice did not experience the euphoric effect, nor did they learn to associate the drug with pleasure. This suggests that intermittent fasting may decouple the pain-relieving benefits of opioids from the neurological high that drives addictive behavior, improving efficacy and reducing side effects beyond the impact on addiction. The study found that intermittent fasting significantly improved the overall quality of opioid treatment. For patients managing chronic pain, the goal is often to maximize relief while minimizing the physiological toll of the medication. The research highlighted 3 key improvements in the fasting group. Enhanced pain relief. The mice on an IF regimen experienced pain relief that was both more significant and longer lasting than the control group. Lowered tolerance. In the control group, tolerance increased by 100%, meaning the mice required higher doses to achieve the same effect. In contrast, the IF group saw only a 40% increase, suggesting they could maintain efficacy without rapidly escalating their dosage. Improved gut health. Opioids are notorious for causing gastrointestinal issues, specifically constipation. The IF mice experienced less constipation and recovered more quickly from the drugs, a finding that aligns with existing knowledge regarding fasting's positive impact on gut health. From lab to clinic, the path ahead. While these findings are currently based on animal models, they represent a promising frontier for human medicine. Unlike the development of a new pharmaceutical drug, which can take a decade and cost millions in FDA approval processes, dietary interventions can be implemented and tested much more rapidly. The research team is already working to transition these findings into human clinical trials. The goal is to determine if a structured fasting protocol can safely be integrated into opioid pain therapy to help patients manage pain without falling into the trap of dependency. All of these results together suggest side effects are reduced and efficacy is improved, which is exactly what you want, says Dr. Stryker. Conclusion: by potentially neutralizing the brain's reward response to opioids, intermittent fasting offers a novel, low-cost strategy to improve pain management and combat the growing crisis of drug addiction. Future human clinical trials will be essential to confirm if these biological shifts can be safely replicated in patients.